Could you lead the change? Could you become a Green Health Wales representative or seek out a group that already exists? Could you find your specialty network on the Centre for Sustainable Healthcare's network sites? Can you organise educational sessions, like using this in your departmental teaching session to play some of our recordings and have discussions about them? And there are so many courses out there. We've got an entire page dedicated to learning more about this topic on the Green Health Wales website. And also, if you'd like to become that representative, we have a specific link for you to get involved on the website. Next step down, have you even checked that your health board's declared a climate emergency? Do you have a sustainability officer? What sustainable action plan has your health board published? And could your health board affiliate with something like Healthcare Without Harm? Cardiff and Vale has done so this year, which means we get access to free resources, free seminars, free international collections of people getting together under the guise of Healthcare Without Harm. Does your QI lead know about SUS-QI principles and projects just within your department or within your directorate? And have you submitted your thoughts via health board feedback or staff opinions, which is really important. Our execs do listen to those feedback forms, and are you telling them what you would like to see?